Good evening, ladies and gentlemen, boys and girls. Welcome to JAHAN-E, your own channel. And today we have a very special guest from London, Dr. Khurshid from health sector. Let me welcome Dr. Khurshid in his interview of. In his first part of the interview, we have seen that how Dr. Khurshid is very optimistic person who has spoken about the vaccine, who has spoken about his own struggles and achievements of life, and who has explained very beautifully that how this COVID has brought the people together globally. So I welcome Dr. Khurshid to my channel.
Thank you.
How are you?
I'm fine, thank you.
So Dr. Khurshid, 2021 has brought lots of hope, aspirations, and whatever the people have suffered during 2020, we are trying to forget that. Lots of sufferings, lots of job loss, lots of educational loss, because I know that I am a principal. I know that how much it was paining to our hearts when the children were away from the education. 60% children of our country, India, they were not able to have any access to the education because they don't have any connectivity of internet or they don't have any gadget. It was really very painful. Similarly, in the health sector also, we suffered a lot. But anyway, past is past now. Now we are welcoming 2021 with lots of hopes. I would like to know your aspirations for 2021.
I think we are already in second month of 2021. What I think it would be helpful for all of us to be prepared and to prepare ourselves that there is no swift return to normal, and life cannot go back too quickly to what it was before pandemic. So bearing that in mind and also being aware of it, it's helpful. It helps you to sort of focus and understand and have that kind of patience, because people are, rightly so, they're getting impatient about it. Also, they want some sort of normalcy. They want to bring some kind of system, some kind of daily routine, which is very difficult, challenging, especially for youngsters, children, those who are in education. Things are slowly opening up, but it will be a slow process. And I think the balance would be that it'll be online as well as face-to-face or classroom teaching. There will still be a need for some sort of social distancing. There will still be need to maintain some kind of precautions which we have been taking and advised in this period. But I mean, there are two ways of looking at education. One is either which has been lost, and children, they need to be brought up to that standard, or start afresh and not judge or just on their exam base, or just on what they achieve, the way the judgment is done, or rather than redoubling the effort. And so some of these children, probably they will need a lot more input, they will need a lot more encouragement, they will need a lot of support, which is not going to be easy for educators like yourselves and your team, because this is a big challenge. As it is, some of those youngsters, they have fallen behind. But the human resilience, which I have mentioned before, and children are resilient, and they are helped and provided support. I'm pretty sure they will bounce back. It will not be easy, it will not be quick. It may take a year or two, we may be next year before they can sort of get back to where they should have been, they would have been, had that not been a pandemic. So for education, that's what I hope, and that's what I think. Some of these, like in Western world, some of the exams have been cancelled, and youngsters or students are being assessed on their classwork or by their teachers, which is not the same. There's a lot of disappointment, but then there are other ways, and then so some of those learning, they can be derived, and I'm sure they will bounce back. So that's something about. For healthcare sector, there is a vast difference. In Western world, where I am in the UK and in London, the health is organized, is provided by the government. There's a whole lot of infrastructure. There are lots of healthcare workers, or from doctors to all the support staff. But there are shortages here as well. Doctors are burnt out. They have been working very, very hard. Healthcare professionals are burnt out. They've been working very, very hard. There's been a lot of casualty as well, unfortunately. But again, with uh, with kind of planning, giving them rest, giving them support, bringing new people on, doing things slightly differently. There are plans and it will achieve. In India, health is private largely, which is a challenge itself. It's not easy. A lot of people have probably during this time, they have not even bothered about their health because their concentration of being there, just living day by day, getting by day, rather than trying to sort of, or could not afford. A lot of people have lost their jobs. So health challenges will continue for a year or two. Also, those who have had COVID, there's a long COVID, so they will have that problems, unfortunately. But uh, to draw a parallel and an example, the last biggest pandemic was the Spanish flu in 1920s. That lasted about 2 years and it killed 50 million people worldwide. I mean, huge, staggering number. But what happened to the virus? It gradually sort of petered out. It became weak. It didn't go out completely. There was no vaccine. But then what happened? It became weak and it sort of petered out. But people, and that was after First World War as well. But the world recovered. People worked hard, they tried, there were struggles, but then so that if we maintain and learn something from that, and also there is a vaccine here which is going to help. Overall, if we take this into overall package account and exercise a kind of self-discipline, working a bit harder, and also using the right opportunities, inshallah, we will all bounce back. Our human nature is resilience and endurance.
Thank you very much. Yes, of course, the human is resilient, and the human can adapt with the situations very easily. And now the almost in India, I have found that at most of the places, the people are working normally, and it is considered like the normal life is going to come back. So slowly and gradually, the things are getting into the normal situation. So I would request you, Dr. Khurshid, that what would be your advice to the students and the teachers and the parents, that whatever had happened during pandemic and whatever losses we all have suffered, so how they are going to cope up with the situation and how we have to move ahead. Your messages.
So oh, thank you. Thanks very much. I have some general advice, and this is a general advice for working for students, for teachers, and for those who are in a job. And so some of the things I find that people at times either are not mindful of or forget, that this can-do approach, to have that positive can-do approach, also the approach to get it right first time. Because at times what I find that people uh, people are not paying attention to it, or they are not listening, or they're not learning from what has been there, what has been provided. So some of those things can do, try and get it right first time, listen, learn, and apply whatever, and seek out. So don't wait for it to come to you, seek out. So you have to make use of the whatever is at your disposal, and especially technology, which is wonderful if you can use it right way. Um, for health workers, I would say world over, be proud of yourself, what you've been able to do during this time. Give a pat to yourself. Others will appreciate, but you should feel good that you have done so. You put your life and limb online. You could have been killed, you could have been seriously ill, but no, you have put yourself online and you have helped others. So what are you going into health? You have achieved that. They should derive some sort of satisfaction, and the challenges will not go away. So try and balance a life whereby you can work and the leisure life and the family life. Try and draw balance that that balance brings that re-energizes you, gives you that hope. Going to some sort of training and peer learning. There are all sorts of other things. Seek help if you need to, either informal or formal, and continue to do your good work, because that's what you have done. For educators and teachers, I would say continue to be bold, to experiment, to draw up a new balance. The new balance will be is the combination of online technological use and the face-to-face learning or peer learning. So sometimes, say for example, you said that in some parts they don't have either the internet connection or the technology or the gadget itself. If there is only one student who has that, or one family has that, if they can sort of help others, they can become the ambassadors. They can learn, or so those kind of things. So also for teachers, my request is that show that you care about their about pupils. They show that they are they they are important, they are valued, they deserve respect, they are most important. Because at times in our societies, and especially Indian society where I come from, this is on hierarchical basis. It's not always reflected, where it's a power domain where teacher is always right. It can't be. It's not true. We all know, but teacher is not always right. But also because you have the authority, so you have responsibility as well. So teachers can do a good teacher. You always remember you're a good teacher, no matter what you do in life. So, and we all can become good teachers by not only teaching the subjects, by doing all these things which I have just shared with you. For parents, I will say, show them that you love them. Show them that you affection, you care. So it's just reminding all the time, or just telling, don't do this, don't do that. It's not always helpful, although you mean well, but it does not always work, and we all know that. And also, help them with their physical and mental well-being. Keep an eye and see for any telltale signs. If your child is normally very talkative and they suddenly go quiet, also bear in mind that they don't have that normal peer support. The school, the classroom support, their friends, playground banters, some of the things where they have their outlets are limited now because they're stuck at home, or they're limited, they can't interact, they can't say things. So parents, they have an important, it's not only feeding them or trying to educate them, but also to show all these overall um, well-being and respect for them. So, and for students, I would say to students, be kind to yourself. Just say, don't over criticize yourself. Try your best. Use time wisely and make a routine for yourself, and create a sort of balance between your learning time, between your leisure time, between your social time. Make a kind of a kind of routine which you can broadly follow. But smarter use of time, I mean that, so for example, social media, one can easily spend 24 hours on social media, but it's not very smart use of your time. So that kind of balance whereby it's not easy. And also to students, I would say this is applies to everyone, but students especially, take regular exercise. For example, even if you don't have a park next door, you can do it in your room, in your living room, or whatever space you have. For example, some push-ups, some squats, some of these basic ones, some of the follow, which regularly done is very good. So go out for walks, connect with people you find stimulating, you enjoy their company uh, through social media, through phones, or through other networks, and 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 just look at the goal, what you're trying to achieve, rather than one of the approach which does not help, what if, because what if it was like that is fine, that's true, and that is a question, but then the answer is, does it help? It doesn't. So that's something. But I've also got a message for the administrators and owners of educational institutions like private schools or private colleges and other establishments, that they should consider including in their charter this social, ethical, environmental, and compassion. Because if you see social, it's their responsibility towards the community, that how they are part of that community where their establishment is, and what kind of contribution is making, just beyond, not only teaching, beyond classroom activity. One of the social, and this can be inculcated in students, in their pupils, that, say for example, one of the things is the Japanese example. In Japan, in certain parts, students, they are required to clean their classrooms, and where there is these volcanic areas, there's a lot of volcanic ash, they have to clean it first before they go into classrooms. And there are in other parts as well. So they should think of some of these things, inculcating in children some of those things. Or, for example, the seva culture in Sikh gurudwaras or Sikh community, and also including this, say, visiting to various centers, various religious groups, whereby this creates greater understanding amongst people, so that if they're from one particular background, one culture, or one religion, they understand others, and with that kind of purpose. In terms of ethical, it's being conscious that what you're doing is ethical. It sort of conforms to the moral code you set yourself. It's not only legal, you set yourself those, and also what the fees you're charging, the kind of education you're providing, the way you're treating children and their parents, and your employees, those kind of things. And environmentally is that there is greater awareness. There are lots of children, they are very active. I mean, I'm sure all public school students in India, they know of Greta Thunberg, because she's a child environmental activist. So that kind of awareness, even if you have a small campus where there is not a lot of ground, you can still create, say, in pots and in pots, some of the plants, some of the other things. Or take children to a park or a gardening center, so that they are aware of what's happening with that and how that they can inculcate into in their daily life. Uh, and also compassion, because whatever you do, if you do with compassion, then it has a greater meaning. It goes beyond just providing them with either rote learning or a certificate or even high achievements. But then compassion goes all the way, it remains with you all throughout your life. And you are a better human being for that.
Thank you very much, Dr. Khurshid. Your advices, I was just engrossed in your advices, especially when you were talking about the parents that show your love and show your compassion, because we all love and we all have compassion for the children, but we hardly think of showing to the children. This showing is very, very important. And then uh, we have to take special care of the physical and mental, both the health of the children. And even exercises, how exercises are beneficial, we can do even in our rooms, and how social and ethical responsibilities the schools have to discharge, and the management and the parents and students. All your advices are so, so beneficial for all of us. Thank you very much for sharing your experiences and your advices. And I hope that next time, whenever JAHAN-E is going to request you to grace us with your benign presence, I am confident that you are going to grace us by the grace of Almighty.
Well, no, thank you very much. As I said, thank you for the opportunity and thank you for considering me worthy of it. If anything, which can help anyone through these mediums and through your efforts, is I'm only a contributor, but it's your efforts, your team's efforts, which is commendable. And I may this grow to become even bigger and benefits all sections of the society and all the youngsters and all the children, even if it helps one person to get in the right groove, right thinking, right approach. And if they benefit from it, then you've done your work. So well done, and congratulations to you and your team, and thank you for including me.
Thank you very much. Thank you. It's an honor for us. It's an honor for JAHAN-E. And my dear friends, thank you very much for watching us. If you like the interview and if you have been benefited by this interview, please share. And because when we are going to share the good things among our friends and people, it's going to multiply. And we should always try to multiply the goodness in our society. And JAHAN-E believes in this, that we have to share our knowledge and experiences, and we have to bring harmony among all the sections of the society. With this, I come to the end. Let me thank once again Dr. Khurshid from London, and thank you all for watching me. Take care and bye-bye.